Hello and welcome to Discovering the World of Natural Health. I'm your host, Claiborne Holtzman. We talk about Silver Sol, we talk about the benefits of the silver gel, silver solutions, all the different things that it can be used for. But what about if there is a medical doctor that can say, hey, look, this is what I use it for in my practice that would benefit us and help us. I'm going to give that information to you today. I have the opportunity of having Cynthia Eaton, and Dr. Eaton, she's an OB-GYN. Dr. Eaton is a fellow of the American College of Obstetrics and Gynecology, a diplomat of the American Academy of Anti-Aging, and currently practices as gynecology and preventive medicine at her wellness clinic she's in Bracton, Florida. She is an expert in the clinical application of silver and technology. And some of this information we're going to share with you today is going to kind of be, real and what it is and why it works and how it works. It's just good, common sense stuff. So, and Dr. Pedersen, he's a PhD from the toxicology program of Utah State University, has a master's degree in cardiology, rehabilitation, and wellness. He now serves as the director of the Institute of Alternative Medicine and was nominated to the chair of the United States Pharmacopeia Review Board Natural Products Committee. And he's a formulator of over 150 different products. With that in mind, folks, I want you to know that this information is technical, it is kind of blunt, and you use your discretion as to how much of it you want to be able to say it. But it's in the real world we're talking about. We're talking about things that actually are beneficial to you. And men, this is a woman's program that's happening today. If you want to do it to better understand the woman, please watch. Otherwise, we're catering to the lady today. God bless you as we go forward to the Health Professionals Integrative Solutions for Health Professionals.
Hello and welcome to another segment of Integrative Silver Solutions, where we examine the most recent applications of Silver Sol technology. I'm Dr. Gordon Pedersen, and today my guest is Dr. Cynthia Eaton.
Thank you for having me, and thank all of you for joining us to continue the collaborative effort for the benefits of our patients and their families in staying healthy and keeping up with cutting-edge technologies in the advancement of modern medicine.
She is a fellow of the American College of OB-GYN. She is a diplomat of the American Academy of Anti-Aging and Regenerative Medicine. She is currently in practice where she has a gynecology and preventive medicine practice and her wellness clinic and a medical spa in Bradenton, Florida. You're very busy, aren't you? In addition, she is an expert in the clinical applications of Silver Sol technology. And let me begin with what this means today. We have a product that we'd like to review because it can be integrated into the common uses of female health. Here's a letter, if you'll hold that up for me. This letter comes from Dr. P.K. Carlton. He's also the Surgeon General of the Air Force. So he's a medical doctor and a general, and he has written this letter to Secretary Ridge, who is over Homeland Security. He is requesting this product. Here is the letter I'm reading from. I would like to bring your attention to a resource that I feel can be utilized in the area of biodefense, from bioterrorism to infectious diseases such as SARS. This antimicrobial has undergone rigorous testing and has been found to kill anthrax, bubonic plague, hospital staff, and SARS. It is the first new antimicrobial for the hospital in many years. This product is non-toxic to humans, EPA approved for hospital staff, and currently awaiting Section 18 approval for anthrax. This solution has been shown to provide wide-spectrum antimicrobial and biodecontaminant activity that can be used to increase the safety and functionality of healthcare facilities in the event of bioterror attack or infectious disease outbreaks such as SARS. In short, we currently do not have anything with such a wide spectrum of efficacy in our inventory. As such, I recommend that this antimicrobial be evaluated for addition to the National Pushback Stockpile. It will make our nation a safer place to live and work. P.K. Carlton, M.D. Silver is an integrative solution because it has been proven to be such. There are many silvers that have been out there, and historically we could talk about a number of different issues. But I want to talk to you about this one that has a patent. The fact that it has a patent indicates that it's been documented to have specific claims. I have a list of over 180 different scientific studies. Each paragraph indicates one more scientific study that documents the benefits of this new and patented form of silver called Silver Sol. In addition to these hundreds of studies that document its benefits, we also have 14 safety studies in this binder. These safety studies document that, in fact, it can be non-toxic topically and internally, so it can be used as a liquid or a gel. And the fact that it passes through your body unchanged means it produces no harmful metabolites, so it is, in fact, non-toxic as it passes through your body. It is new and beneficial and has been presented in this document before a subcommittee of Congress. Herein is the science that was also given as substantiation. All of these studies documenting that this is new, this is unique, this has been proven to be of benefit, and it is different from other silvers of the past. In fact, here's a medical study that's presented on MRSA. This publication documents that by using it topically, it can destroy MRSA on the skin. We also have a study on MRSA benefits internally. Not to mention internal uses, it saves people approximately 45% in the treatment of MRSA or other infections when dealt with in the nursing homes. In addition to that, here's a publication from Penn State University documenting what it is, how it works, why it works. It even has photographs in here taken from an electron microscope documenting its frequencies, its resonance, and all of the ways in which we have proven that it works. And by the way, we don't know all the ways it works, but we have documented at least 4 mechanisms of action that in fact it does work. This is another published study that documents it works in combination with antibiotics and will, in certain cases, increase the efficacy of the antibiotic by a factor of 10-fold. So we have synergism when we use it with antibiotics as well as safety. Here's a study that goes all the way to bird flu, where it works as a preventive agent in bird flu. This is the CNBC press release that picked up these type of studies and has published them, helping you to understand that this is in fact a new, a unique, and a patented product that you can believe in. That is why I'd like to present it to you as a way to integrate it in with the normal health and wellness, especially today, applied to the female health system. Now that we've reviewed how the studies and how the literature has shown that silver can benefit bacteria, viruses, and yeast infections, let's take a look at how it can be integrated into the care of the female health and the patients that will be using this product. Where would you like to start?
Let's talk a little bit about female patients and their desire to douche for a number of reasons. The most common reason female patients ask me about douching usually involves post-intercourse, post-period, after a vaginal discharge or being treated for some type of vaginitis, and their desire to clean and maintain the vaginal vault. The silver is a very, very nice way to do that. It can be mixed in a disposable douche that they can purchase anywhere. In about a 50-50, you want it in about a 1-to-1 ratio, just clean, sterile water and the silver solution, and it can be used sitting on the toilet or whatever position women are comfortable douching in order to clean out the vaginal vault, prevent bacterial infections, treat a bacterial infection, or get rid of an undesired odor. This can be used in several instances, as I mentioned earlier, when you're treating your patients for post-menstrual situations, post-coital situations, perhaps after a retained tampon is removed, etc. It's comfortable, there's never a sting or a burn, and the allergic reactions that you sometimes see with other medications in the vaginal vault will not occur using this system.
Okay, so let me say exactly what the studies have shown why this works. When you take this liquid, and assume now that you're 50-50, silver 50-50 with the distilled water. When you rinse it out, the studies have shown that it destroys yeast, but it takes about 6 to 10 minutes to completely destroy it. So if we can get this liquid in contact with the pathogen, whether it be yeast or bacteria, you're going to totally and completely destroy that. So a continuous flow, if you will, or a slow dispensing of this will probably be the most effective way to deal with this. In addition to this, you're going to see problems with pelvic inflammatory disease. Help me with what you would do for pelvic inflammatory disease, and include discussions of how you would creatively use silver gel with a tampon.
Pelvic inflammatory disease can be treated as both an inpatient and outpatient, depending on the severity of the disease. In the event that the CDC criteria are met for inpatient status, the patient will have been admitted to the hospital and treated with intravenous, most likely antibiotics, sometimes intramuscular antibiotics. The silver is still a very important integral part of treating PID, whether the antibiotics are currently being used or have been used in the past. The douching that we described earlier can be used in the vaginal vault to keep it well rinsed while the bacterial infection is being treated, and the gel can be applied to the cervix in one of two ways. Here are two types of tampons commonly used by women. It's really a personal preference. I don't have a preference for either one. I truly leave it to the patient. This is a tampon that does not have an applicator. This tampon happens to have an applicator with it. The applicator-free tampon, the gel can be applied directly. Just about that much. I usually tell my patients use about a nickel size. Dime size may be a little bit too small because you're going to lose a little bit of gel putting the tampon into the vagina. A quarter size is probably going to be about too much, but won't hurt the patient. We'll just overuse the silver and waste it. But a nickel size or about that size is going to be just about right. So that's how you would apply it directly to a tampon that is applicator free, such as this one. Now, if you wouldn't mind holding that for me for just a second. This is a tampon. This happens to be a plastic applicator. Some women choose to use tampons that have a paper applicator. And the trick here is to have your patient push the tampon out of the applicator just slightly so that the silver can be applied in the same manner. It's about that same nickel size amount. And then put the tampon into the vagina and dispense it as it is normally dispensed by pushing the applicator forward. It should be worn in the vaginal vault for about 90 minutes. Now, the silver works very quickly, and I'll let Dr. Pedersen make a comment about that. The silver works more quickly than that, but the tampon helps keep the silver in place while the treatment is taking place. And before he makes his comment, I just want to add one other thing. For your patients that have vaginal infections that have already been hysterectomized, that you're not necessarily aiming for the cervix, it's okay. You can still place a tampon in a vaginal vault in a hysterectomized woman with the same wonderful results.
When you integrate the gel. You can also take the liquid, 2 teaspoons twice a day, and what you're going to get is you're going to get an internal benefit as well as you're going to get a topical one. Now this has been studied in Current Science, a medical journal, and we saw that earlier where it benefits the antibiotic as well as the silver. So you're getting a symbiotic relationship here. In fact, you're getting as much as 10-fold increase in the ability of the antibiotic to destroy the bacterial infection. So what you're getting is, you're getting synergy between the silver and the antibiotic. We have 2 publications to document this, and you can see that it only benefits the patient in that they've got to put it in contact with the offending pathogen.
May I just add one comment while we're discussing placing gel into the vaginal vault? In my office, when I am treating patients with vaginal gel after a procedure, after cryotherapy, after colposcopy, or in the event that they've come in with great discomfort from a yeast infection or bacterial vaginitis, it is also very convenient and easy in your office to place about that same amount of gel, a nickel size to a quarter size amount of gel, on a large Fox swab and actually place it in the patient's vaginal vault while you have the patients in your office. This can be done in addition to that with an applicator, which you can just keep clean with soap and water if you choose, or in something else that is given to the patient in some kind of sample form.
So do you regularly recommend to your patients that they take on a regular basis, prophylactically if you will, the liquid silver? Do you regularly recommend 2 teaspoons twice a day?
It really depends on the patient, and it really depends on the state of the patient's health. For my patients that have immune issues and immune compromise as a regular part of their health history, I recommend the silver daily for a minimum of 3 months as I follow them closely to see how their immune system responds. To women that do not want to use the silver on a daily basis or can't remember to do so, then certainly if they're having, for instance, outbreaks of herpes every month on their periods, I recommend that the week before their period starts, they start on regular 2 times a day dosing of the silver, and the silver gel is to be applied to anywhere on the vulva or in the vaginal vault where they are prodromal for herpes type symptoms or lesions. The gel can also be used for patients that complain of recurring yeast infections, recurring bacterial vaginosis, as you're working up their other problems such as diabetes or immune system compromise, stress-related somatic complaints and illnesses. I would have them using the gel in their vaginal area, on the vulva, within the vaginal vault, in addition to the liquid, during the period of time that their symptoms are recurring.
Now, we have a pad here. Talk to me how you might integrate the use of a pad with the gel with the liquid as well for some of these situations such as vaginitis.
Now, this is a nice opportunity to talk to colleagues who do a lot of geriatrics, people who are in a location like I am, down in Florida. We have an older population. These women are very frequently and often plagued with chronic vulvovaginitis. Some of it is as a result of atrophy, the breakdown of the skin. Many of them have urinary incontinence, and the constant wetness and irritation of urine to the skin results in them having frequent urinary tract infections as well as chronic vulvitis. What's nicer for these older patients who will struggle more trying to place tampons correctly, etc., the gel can be placed on a panty liner or sanitary pad. I have them just squiggle a little line just like this for very good coverage. In addition to that, it can be sprayed right directly onto the pad. Keep a little spray area like that. It can be sprayed onto the pad. It can be sprayed onto the vulva directly and worn for comfort and to prevent the breakdown of the skin and the irritation to the vulva and chronic vulvitis. In addition to that, since so many of these women have chronic vulvitis as a response to the wetness from urinary incontinence, they frequently will have recurrent UTIs, urinary tract infections, and so it is very helpful for them to be taking 1 tablespoon 2 times a day of the liquid silver, and you will notice a decrease and possibly complete resolution of these recurrent urinary tract infections as a result of using the silver.
In some of the research that we've been doing on this with urinary tract infections, we found that because the silver passes through the body unchanged, there's no harmful metabolites, but it pools in the bladder. So it cleanses the kidneys and it cleanses the bladder. And what I mean by that is it kills the bacteria that's causing the problem. So if you're taking it 2 tablespoons twice a day, and it passes through the body unchanged, it pools in the bladder, it has the ability to kill the pathogens that are in there. So you'll actually find, in our research we've actually found, that people who had a bladder infection, even to the point where they were passing blood and pus, they still were able to destroy the bacteria as measured in a UTI kit, and they were able to do so in 2 hours. They were still passing blood, but there was no bacteria left, indicating that this does pass through as a liquid through the body, through the kidneys, into the bladder, and it will still have its ability to destroy bacteria in the bladder by doing so. And don't forget, the gel is a very, very good product because research has shown that it kills sexually transmitted diseases like chlamydia, like syphilis, like gonorrhea. So use it as a personal lubricant. How could that help in these women who have chronic yeast infections?
Well, I want to touch on that, but before we leave the bladder, let me just go back and say a couple of more things about this that come to mind. For those of you that are performing urodynamics in your office, for those of you that are doing cryoablations in your office where you place for any reason a Foley, let me add 2 things you'll find incredibly helpful in your practice. The gel makes a wonderful lubricant for the Foley as it goes into the urethra before the balloon is inflated. It will also prevent urinary tract infections should something be starting chronically there and you're not seeding the urethra. So it's very helpful for the placement of the Foley catheter and will not clog it. The liquid nanosilver is a beautiful rinse for the bladder. I don't know how many of you are treating cystitis in your office by putting antibiotics into the bladder, but I would like to see more physicians, and I'd like to gather more data than that we already have, of people using liquid nanosilver as a flush into the bladder for the painful entity that is cystitis, which has not been well treated in the past and from which many women suffer. So those are 2 other uses for the gel and the liquid for those of you that are doing urologic procedures in your office, placing Foley catheters, or rinsing the bladder for any reason.
Now let me ask you another thing about hygiene, since we're still kind of in that area. They suggest that 70% of all diseases transferred by the hands. How do you use the gel specifically in your practice? Before you glove, after you glove, on the patient? How do you use it as a hygiene to protect yourself from, let's say, an MRSA infection or something else?
I wash my hands and use the liquid, the silver gel several times a day. The silver gel has passed the surgeon's hand scrub test, which Dr. Pedersen can tell us a little bit more about in just a minute. But the gel remains bactericidal for about 4 hours after you use it. So I would say on the average in my office, because I'm scrubbing my hands multiple times a day, I probably use the gel every 2 hours or so. And of course I'm washing after every patient. I see one patient about every 20 minutes. About every 2 hours, not just for the bactericidal effects, but because of the dryness and chapping of my own skin and my own hands, I apply the gel about every 2 hours in my office. Can you just tell us a little more about the surgeon scrub?
Oh, that's a great thing. What we did was we basically just put it on their hands, and it wasn't more than about this much here. Had them rub it into their hands, and they were completely pathogen-free for 4 hours. But the important thing that we found from them in their comments was that there's no alcohol, so there's no drying out of the skin. There's no burning of an existing crack or some other rash that might already previously exist. In addition to that, there's no petroleum products, so you won't get greasy hand feel. I'm holding my hand hands open right now. I've just put it on, and literally in about 1 minute your hands will feel normal again. In fact, the comments were, my hands feel smoother and softer. So the biggest problem you're going to have is probably that the nurses are going to use it on their faces as well, which is another topic we'll get to altogether. But yes, you're going to kill the pathogens. You're going to kill them for 4 hours. You're going to do it without alcohol. You're going to do it without petroleum. Now, what is in this product? It has distilled or pure water, and it has pure silver in a nanoparticle form. In addition to that, only 1.4% of this product is a gelling agent, and it is nothing that is going to be a large amount of problems, meaning it won't cause stickiness, it won't cause greasiness, it won't be a problem to your hands or interfere with your function. I do find that the doctors and surgeons I've worked with say they put it on first, leave it to dry for 1 minute, then when there's no tackiness, no slipperiness, gloves go on just like normal. But if you try to put it on wet, you know what's going to happen. It's going to stick to, and all that talc is going to get all pasty. But if you just let it dry, just like my hands are now, it's been about 1.5 minutes, and you can see there's no shininess, there is no stickiness, there's no pastiness. Again, a very good, useful item. And some of the doctors I work with actually use it on their patients and recommend to throw away the KY jellies or those petroleum jellies and use this as a personal lubricant because it destroys not only germs, but even sexually transmitted diseases.
Let me just piggyback on that for a second and talk a little bit more about using it on your patients as well. I have had great luck with the silver gel in my patients that have psoriasis and eczema, and particularly in patients who work in dentistry and medicine and scrub their hands as much as we all do. Those women will frequently complain of cracked, dry, sore hands, and infections, especially MRSA infections, is a huge issue and risk for those working women, even though they glove and wash their hands regularly. So I just want to walk you through how to demonstrate it to a patient and how to get comfortable with that, because your patients will absolutely love you and love this product. So what I do when the patients come in is at the same time I put the gel on my hand, just like you saw Dr. Pedersen do, I do the same thing with the patient. And it's important to go through this so that you understand the science of it. Here's my patient, I put some on the patient, I put some on myself, and I say to them, I want you to do exactly what I do. Now, a lot of times the patients, just like today I have my wedding ring on, I don't when I'm in my clinic, but women usually have jewelry on, and I tell them, you don't have to take your jewelry off. There's nothing greasy, there's no residual, it won't stain or hurt your jewelry, so just leave everything on your hands and do what I do. And I tell them, let's wash our hands. Wash our hands. These women are dabbers. They'll dab. They'll tend to dab like this. You wash your hands with it because you need it on your hands anyway, and you have them wash their hands and do the same thing. Now here's what you need to be telling them as they're doing this. They're going to first feel it very silky because the silver goes on very silky and very clean. What I tell them then is after you've done that for about 30 seconds, you're going to get a little bit tacky. It's going to begin to feel a little bit sticky to you. If you don't explain that to your patients, and I think it's really great if you demo it to them so that they actually see it, you will find that some people will then want to pick up a paper towel and begin to wipe it off their hands because that's what they think it's going to feel like. It stays tacky, I would say, for about another 30 seconds or so, and you can actually now start to feel it. If you are, regardless of whether you're a surgeon or just a clinical practicing doctor, you will not believe the relief to your skin. You will actually feel it as the silver begins to penetrate the skin. The moisture is pulled out of the air, that's just the way it works, and the gel begins to evaporate off the hands. You will feel a cooling sensation, and the stickiness will begin to turn into this incredible softness. As the softness develops, the stickiness goes away, and for about the next 2 minutes, it continues to soften and condition the skin as it stimulates the repair and stem cell proliferation, etc. So demo it on yourself, demo it for your patients, go on about your exam, whatever you're doing to the patient, and when you're done at the end of the visit, say to the patient again, if you choose to do so, feel your hands now, because their hands will be terribly soft when they're done. feel very, very conditioned, but in another 2 or 3 minutes, when you're actually done with your office visit, their hands are going to be even softer.
So I might point out how much benefit this will be to somebody with an abscess or with an infection or with even an odor, because this product has even been registered with the EPA to destroy odors associated with bacteria. So you can see that this is beneficial not only on the hands but to other parts of the female health. And you know what? They're going to thank you for it. In fact, you made some comments to me. What are some of the comments your patients have made to you after you've got them to the point where they've used it on their hands and on their vaginal parts?
Well, I'm glad you brought that up, because it is a good point that when you're done with your demos and the patients are leaving your office, I give them the demonstration on their hands, not because I'm trying to soften their hands. Really, I'm usually going to apply it to the vaginal area and have them use it either on the vulva or in the vaginal vault. I do the demonstration on the hands to show them how gentle and soft the silver is, and I say to them, if it's this gentle and soft on your hands, then you can imagine that on your vulva or in your vaginal vault, this is the same product that is going to keep you healthy, fight bacteria, keep you from having painful herpetic lesions, etc. And invariably, I've been doing this now going on 2 years. Every patient I have absolutely loves it, and they want to use it on their hands, they want to use it on their children, they want to use it in their vulva, they want to use it as a personal lubricant, and all of those things are appropriate. What's important to bring from a clinical standpoint is that you will choose what works for your practice. You will choose what works for your patients, and you can have the comfort and the confidence to know that no matter where you use it, it's not going to burn, it's not going to sting, it's not toxic, it's not going to cross-react with medications, it's not going to cross-react with other topicals.
Correct. In fact, we have 14 safety studies, toxicology studies that show even internally it can be taken 200 times the normal dose every day for 28 days and it still doesn't cause any problems at all. You can also be reassured that in 10 years of this product's use, there hasn't been one reported adverse reaction. Not one in 10 years. Millions and millions and millions of uses, and we haven't had one reaction. And again, 14 separate safety and toxicology studies to go along with this to help you know that you can use it in your 6-month-old or you can use it in your 96-year-old. It can be used in every orifice of the body. In fact, regularly the liquids are used as eye drops or ear drops. And again, it does exactly what it would do on the hands. If the liquid comes in contact with the bacteria, the virus, or the yeast, it's going to destroy it completely in less than 6 minutes, oftentimes in as little as 15 seconds. So with that in mind, I think we've covered the hygiene area very well. But one other issue. If a woman is bleeding, can she actually put this product in or on her body at the same time? The studies say yes. How do you advise your patients?
I would say the same thing. The issue there is actually the hygiene of bleeding from the vagina. It's a hygiene issue, not a safety issue. I would recommend, because it's difficult, that you wait until the end of menses. If you have something that can't wait, again, when you go to put a tampon in, the gel can still be added with the tampon during menses. There is not a safety issue there.
How about PMS? Is there a benefit here?
You know, we're still working on that. I think there's a lot to be explored with whether or not the silver will play a role in PMS, because premenstrual syndrome is such a large entity, and it's caused by dietary changes, it's caused by fluid balance changes and those kinds of things. I would feel comfortable making this comment. If your premenstrual syndrome is related to the immune system, and the immune system is damped down or tamped down as a result of your period, then by keeping the immune system really boosted and really strong, by using the silver the week before your period, you may see a marked difference there. As far as a direct correlation, I don't really have anything to add there, unless it's immune system related, in which case I think it could play a great role.
I agree, and the research has shown that it does mildly boost the immune system and support it, but more importantly, it takes the workload off the immune system by fighting the bacteria, viruses, and fungus or yeast before the immune system has to deal with it. So we don't have studies that says it does anything for the menopause, but in secondary issues, secondary to menopause, it can be a benefit. Let's talk a little bit about menopause in general. Is there a menopause benefit?
Again, I think any benefit that you're going to see from menopause is probably going to be an indirect type of benefit. The silver, again, is very helpful to boosting and maintaining the immune system and may actually work well in conjunction with other natural products or prescribed products that are being used for the menopause. We know that part of the aging process for women, which menopause is a marker of, is that your immune system isn't as strong and isn't working as well as it used to. So again, I would say that there may be an indirect benefit that the silver could be taken in conjunction with your other nutraceuticals, your vitamins, your minerals, whatever other prescriptions you're taking, possibly hormone replacement therapy if you're using it to give a boost to the immune system.
Yes, one area that I do recognize and has been reported as beneficial is for vaginal dryness, and that does occur through that process. Could you explain how this is used there?
Now, this is not indirect. This is a direct benefit. And I will say, after 22 years of practicing gynecology, that the silver gel is, in accordance to my patients, the best vaginal lubricant they've ever used. I think the reason for that is it is absorbable, it's water soluble, there's no mess left behind. It truly nourishes and moisturizes the vaginal epithelium, and a big difference is noticed by both the men and the women. And I do want to make a comment about the men while we're talking about this. For my patients that have husbands or significant others that are not circumcised, the use of the silver gel on the foreskin has resulted in less yeast infections in these women, better hygiene for their partners, and I would highly recommend it for men that are sexually active that are not circumcised.
To support that with what we found in the research, there was a hospital in Thailand that does AIDS research and has AIDS patients only, 3,000 bed hospital. And why they did research here was because they found that men who were circumcised reduced the risk of transferring the AIDS virus by about 96%. In other words, there were only 4% that were transferring the AIDS virus that had been circumcised. So by circumcising a man, we've discovered that the virus of HIV and AIDS is underneath the foreskin. It does reside there, and so when men use this product, circumcised or not, it's going to be a benefit to the women because they're not going to transfer viruses, bacteria, or yeast nearly as much.
A few more comments about using the gel as for personal lubrication. The gel can easily be placed in the vaginal vault with a vaginal applicator, as one sees with estrogen creams and other vaginal medications. It can be placed again into the vaginal vault with a tampon. That's something easy that most women have easy access to at home or at their local drugstores. If you're using it for vaginal lubrication and you have a particularly dry vagina, the nickel quarter size rule doesn't necessarily have to apply. You may need to use a larger amount, which the patients can titrate to their comfort. It's also very nice to the vulva on the outside for dryness there. Sometimes their friction with intercourse causes a great deal of discomfort, and it also works very nicely there. It also works well in our younger patients who seem these days more and more to be choosing to shave their vulvar area. I have them use this after they shave. There is a reduced incidence of folliculitis. It's very cooling, it's very soothing. They don't seem to get the shave bumps and the rash if they use it after they shave their vulvar area. So I have found that to be very, very helpful.
And they go right ahead and shave their legs with it as well, so helping to prevent the same problems with that. Tell me about herpes. Where is this appropriate in the use for herpes?
I have found that in my patients with herpes, whether it's a primary infection or recurrent infection, the combination of both the liquid taken in a 2 tablespoon twice a day dose during any prodrome or outbreak works wonderfully. The gel, as we spoke of earlier, can be placed in the vaginal vault with a tampon or an applicator for vaginal lesions. It works beautifully topically on lesions. It does seem to very quickly resolve the pain and discomfort from the lesions. Another place it works very well is for herpetic outbreaks on the mouth. Canker sores, cold sores, herpetic lesions on the mouth. The gel can be applied directly. If you are skiing or in cold weather, it seems to work a little bit better if you mix the gel with petroleum jelly because it stays on the lips a little bit longer.
Let me address that from our research point of view. What we found with this with regards to the fever blisters or herpes simplex is when you take the gel and you apply it to the lip, it donates moisture, but it doesn't donate moisture enough that you couldn't use another product like a petroleum, a Savex or a Carmex or something like that. But you do not have to use any of those because those will occlude the viral blister. And if that happens, the virus will continue to merrily go along with all of its spreading and seeding and spreading throughout the system. But we've found if you can catch that herpes virus in the first 4 hours by putting the gel on and keeping it moist, that might mean you need to put it on every hour or every half an hour even in some cases. But if you can keep that blister moist and you catch it in the first 4 hours, it will not erupt and it will shrink back down, it won't spread, and you will stop it. If you do get it past 4 hours and it does erupt, we have found that the healing is about twice as quick. I know twice as quick isn't a good term here, but half the time with less scarring, with less of the spreading. So this does work in both cases, genital and in herpes simplex, especially if you can get it the second you start to feel that pinch or that sting or that blister to arise. Get it as quick as you can. Keep it moist, and that's what I would suggest your patients are instructed to hear. Keep it moist, and if that means every hour, every half an hour, keep it moist because healing takes place better while it's moist.
Can you make a comment about the tolerance of temperatures, of extreme of temperatures that the gel will tolerate?
Yes. In a research study we did with the Department of Homeland Security in Singapore, they actually boiled the liquid and they froze it before they did any testing, after which they found that it was 3 times better at closing a wound, at fighting infection on the surface than any other drug or any other silver that was tested. So from that point of view, you can boil it and you can freeze it and it will still have the same effectiveness.
As long as we're on the face, can we just continue a little bit with a little more facial care, facial health? The ability of the silver gel to treat and symptomatically relieve from acne is also impressive, and I've used this quite a bit in my practice. Let me just preface my remarks by saying I first used the gel for acne in my own children. My sons are 13 and 15, and found that even though teenage acne is frequently hormonal, there's also usually some bacterial component to it. The application of the gel to teenage acne is really quite stunning. It may take as long as, correct me if I'm wrong, 28 days for the entire cycle of a very severe acne outbreak to resolve. But the typical little smaller acne outbreaks in between, I have found, starting with my children, now moving into my patients, is only about 48 hours. And you'll see the erythema and that sore redness and the discomfort resolve within about the first 2 days. The entire cycle of acne itself may take 28 full days of the gel to resolve. And I treat my patients by having them wash once in the morning and apply the gel, my kids before they go to school, etc. Again, wash the face and apply the gel at night before they go to bed. If they can take the time, I have them, put a warm washcloth, a very warm washcloth on the face after it's clean before they put the gel on, so the pores are a little more open and the silver can really go in and do its work. And before we leave the topic of acne, let me just mention that acne, we traditionally, especially as physicians, think of acne as occurring in teenagers. It does occur at that time with hormonal changes, but babies get acne and women get acne when they go through menopause, particularly if there's some kind of an imbalance there, which by definition there typically is with menopause. So we see acne in midlife, we see acne in children, we see acne in babies. Some babies get acne on their head, which people refer to as a cradle cap type of thing. This silver gel does the same thing for all three of them. It will, if the bacterial component is large, the acne will resolve very quickly. But even if the acne is of a hormonal origin, complicated by the common bacteria that we find on the skin, staph and strep, etc., etc., it will still improve over a shortened period of time with this silver gel.
Yes, and don't forget that you can treat from the inside when you take 2 teaspoons of the liquid twice a day, so you get that benefit as well. In addition to that, you can point out, I should point out that skin conditions like diaper rash resolve very quickly. In our research, we've seen that skin conditions like diaper rash in small infants, simply by putting on the gel, resolve with a dramatic response in the first 2 hours, almost totally being unnoticeable after 4. So it's a good response there as well. Again though, if the liquid or the gel cannot come in contact with the actual bacteria that causes acne, it won't kill it. So if you get frustrated with a patient that says, I put it on and it's not working, maybe you can try this. And this is a device that's nothing more than a steaming device for the face. What it is it's a heating plate. We put the silver directly into the heating plate, so you're getting a steamer. This isn't the only steamer you could use. You could also use just a very warm washcloth for a minute or two. But you can go ahead and put your face in here. And as you can see by the steam that's created, now you can steam the entire face. A secondary benefit is that they will inhale the steam and it will go down into the lungs, and it can have a significant improvement for bronchitis or pneumonia if those are bacterial or viral as well. So you can see that if we can get the liquid into where the pathogen is, we're going to have a significant improvement to those symptoms, and even to the cause of acne in this case. In addition to just breathing this steam down into your lungs, what you might want to do is use a nebulizer like we have here. With the nebulizer, you can just open it up and you can put the liquid right in. The liquid silver goes right in here. You do not need to dilute it. This can also go in a CPAP machine if you'd like. With the mist that's coming out, you can see that we can distribute tiny little silver particles clear down in the lungs where they can have a benefit against bacteria, viruses, and even yeast. This should be done about 15 minutes twice a day. If not, you can do 30 minutes once a day. But this is a marvelous way to help people, whether you attach the breathing apparatus or the actual nose apparatus. You can see that the idea of a mist going deep into the lungs can be of significant benefit. With that in mind, there's a couple of other tools that work very well. One of them is an intranasal sprayer. Now this is nothing more than the silver put into a spraying device that makes a fine mist. This goes into the nostrils, about 3 or 4 sprays and a sniff, 3 or 4 sprays and a sniff, and you're going to just wipe off whatever residual comes out. This is important because it delivers a mist far enough up into the sinuses where the liquid can come in contact with the bacteria. We do have eye drops, we do have ear drops. These delivery systems are very effective as well at delivering to the eyes or to the ears. I might want to point out ear infections. We don't have antibiotics that are really specifically for ear infections or that work totally every time. Yet when you put ear drops in, it's this simple. Turn the ear to the roof. Fill the ear canal with ear drops. Let it stay in that position for 10 minutes. The reason being is it takes that long for the liquid to come in contact with the pathogen. Then drain that ear, turn and do the other ear. But the important thing is 10 minutes with the ear toward the ceiling position. Other benefits do you see here?
But there's just a couple of things that I want to mention for my colleagues. With the nasal sprayer, this has been a huge success in my practice for patients with chronic sinusitis. It has been a real 1-2 punch to treat so many of my female patients with the spray in their nose for chronic sinusitis, and to get rid of the yeast that they get from long-term antibiotic therapy for chronic sinusitis through the winter with the gel. You'll find that when you are treating sinusitis regularly with the silver, you're not going to see the yeast infections as much, because you're not going to be treating patients with 3 and 4 weeks of antibiotics at a time. A couple of side notes about this. If the patient is already on some kind of steroidal therapy that makes a coating in the nose, then you may have to choose between the two of them, because the coating stops this from going in, and this will prevent the coating from being laid down. So you may have to make a personal choice based on your own medical decision for those patients. This is fabulous for chronic sinusitis, for allergies, for stuffy noses. It works very well for patients that are chronically infected with MRSA. As most of you know, those patients, we often swab the nasal cavity to determine whether or not they're chronic carriers, and this will get rid of MRSA if they're colonized in the nares. If you live in a very, very dry climate, I live in Florida where it's very moist, but here in Utah it's very dry. The weather's very, very dry, and this will not necessarily moisturize the nasal passages as much as they need to. You may find that they have to first spray with the nasal sprayer and either place the gel or some Vaseline or aloe or something else in the nose to provide enough moisture there. If you live in a dry climate, just spraying alone may not be enough. You may need to add a petroleum-based product that's safe for the nasal passages, or the gel. The chronic sinus drainage, postnasal drip, sore throat, laryngitic patient can benefit from the spray, which we demonstrated earlier, going straight to the throat. Especially, I have lots of patients who are in the entertainment business, and they sing and they can't strain their vocal cords and things like that. When they get colds and viruses, they panic, but we bring them right back out of it with the nasal spray to the nose, 2 sprays in each nostril 2 times a day, and frequent spraying of the throat. Anytime it feels dry or they feel like they need a little spray, this can go right to the throat for that. It's great for children because it does not sting, it does not burn. If you miss and it goes into the eyes, there's no kind of irritation there.
And this is a device that you can deliver this with for sinuses. It's simply a tube on a nozzle. You fill this up with silver liquid and place it in the nostril, stand over the sink or do this in the shower, and you can actually rinse the sinuses with this, rinse the sinuses with this, and that flushing action functions similarly to how a douche washes out the vaginal vault as well.
I want to make another comment about the drops to the ears. We do have to be very careful with this. The pediatricians will make the determination in children as to whether or not antibiotics are needed for an ear infection. However, if the pediatrician is treating your child for an ear infection, the silver will not disrupt the action of the antibiotics. They're very synergistic together. I have treated one very interesting case. I was sent in my town, we have world-class athletes. I was sent a kid through a primary care physician who has chronic, is a swimmer, world-class swimmer, chronic Pseudomonas in the ear. This young man spent about 5 months out of the year on antibiotics chronically for Pseudomonas recurrent infection. We took the drops, as Dr. Pedersen described. We had him putting the drops. We put the drops in the ear and then placed cotton in the ear to keep the moisture there next to his ear. The Pseudomonas infection resolved in 5 days, and he's never had a problem since, and he uses the silver in his ears regularly. And that was just a great, successful, residual infection type of case, which is very typical of the kind of results that we get with the silver. So if someone is going to use it, it can be used by itself. It can be used in conjunction with antibiotics if the pediatrician prefers that the child or the primary care physician prefers that the patient is on some type of antibiotic therapy. You put the drops in the ear. I would recommend that you put a little piece of cotton so it doesn't run back out and it stays in place. It'll absorb and treat the infections very effectively.
Twice a day?
2 times a day.
As you can see, we have significant benefits. One more might be simply to take a toothbrush and use the gel on your toothbrush and brush your teeth with it. We know that a lot of the bacteria that resides in the mouth and gums can enter the system and cause heart disease or other problems. By brushing with this, they can actually swallow the gel and they get a twofold benefit. If you like and you want that foaming action, you can just put half gel and half toothpaste. Now you've got a situation where it feels the same, tastes the same, looks the same, but has an antibacterial benefit as well. And then dental floss. Put 2 teaspoons of liquid silver into the dental floss, and now your dental floss is able to be a little bit better when it cuts down into the gums, and we do cut into the gums, but it will leave a residual of silver behind to help with that open wound. So with that, I've had a great time discussing these things. I hope that you have as much success as you already have in the past. Do you have any closing comments you'd like to make?
I would say that in your practice, particularly primary care physicians out there, do not be shy about using silver. It's effective. There are multiple toxicity studies proving its safety. We're available to provide more information. A lot of physicians want to see studies. We can provide those. We have those. I'd be happy to discuss any of your concerns. I speak with physicians all over the country and now all over the world about how to apply it to their practices. I'd be happy to do that for you as well.
Thank you so much. And with that, remember there's over 180 scientific studies that have documented the individual and collective benefits of silver. It is patented, meaning it is different. The difference has been documented to be safe in 14 safety and toxicology studies as well. So if I can add my research to your experience, I hope it will benefit your patients.
Folks, hope this has helped you greatly to be able to understand that there is a product, Silver Sol, that can change your life and your health in a positive way without negative side effects. Check it out, come to Remedy This Naturally, and get your Silver Sol for your life, your health, and your well-being. God bless. May good health be yours naturally. I'm Claiborne Holtzman.